You're listening to Astonishing Healthcare, the podcast hosted by Capital RX, focusing on the biggest issues affecting healthcare consumers, benefits plan sponsors, and health plans. We're covering the inside baseball on how things truly work, or don't, in the U.S. healthcare system and pharmaceutical supply chain in an astonishingly efficient way.
Hello, and thank you for listening to this episode of the Astonishing Healthcare Podcast. I'm Justin Veneer, your host and Director of Communications at Capital RX, and joining me today is Lloyd Fiorini, our General Counsel and Chief Compliance Officer. We're going to chat about PBM legislation, what resources plan sponsors need or might need to run a better procurement or RFP process, fiduciary responsibility, and maybe even a little hockey. Lloyd, thanks for taking the time. Can you start us off with a bit more about your background and how you got into the PBM industry?
Well, yeah, Justin, it's good to be here, and thanks for asking me to participate. A bit about my background. I've been practicing law since 1994 when I was called to the bar. Initially worked in several law firms in the Washington, D.C. area before I went in-house at a company called TLC Vision, which we did refractive eye care. And then moved into the PBM space. So I've been in the pharmacy space probably for about 25 plus years in one way or the other, either working directly with the PBMs in representing the PBMs or with retail pharmacy, working with the PBMs in reimbursement and in healthcare in general. So I'm one of the few people that had the desire to get into healthcare law right from the get-go. And so that's kind of how my career path has grown. So
Interesting. Is managed care pharmacy or PBMs, is that something you thought you'd be doing? It seems like an interesting career path for legal professionals. What do you like about it?
well, I mean, when I first came to Caremark, I did target Caremark as a company that I wanted to work with. So I did want to get into the prescription benefit space, if you would. In my private practice, I did work with retail pharmacies as well as representing one of the earlier PBMs that were a division of pharmaceutical manufacturers at the time. And so I think I've been at like the ground zero, if you would, of the PBM industry, and have kind of worked my way through the evolution and where it has come to. It has been a very interesting ride, if you would, of watching the evolution of this industry from, several small whole bunch of companies that just administered pharmacy benefits because medical plans didn't want to do it at the time.
Mhm.
What they are today, which is, huge conglomerates for the most part that have practices that we would say are less than transparent at times, right?
Right. So last year, and I'll include a link in the show notes, you hosted a PBM legislation webinar for our audience, and we focused on the Consolidated Appropriations Act, the IRA or Inflation Reduction Act, and more. You talked about what plan sponsors should do to avoid penalties and personal liability. I think this is more specific to the CAA. So I'd like to ask you for an update given the recent lawsuits we've seen spring up. Could you share your thoughts about fiduciary responsibility for one, employers, and two, benefits consultants? I think everyone draws a comparison between the financial services industry and the retirement plan 401k lawsuits of decades past, and then what's coming for our industry. So what do you think, Lloyd?
Yeah, that's a great question. I mean, I think last year and the year before, people were kind of saying to the industry, "This is coming. We better be prepared." And the CAA was the means of that kind of identification of the new standards that health benefit managers or benefit plans need to kind of work with or be aware of in their day-to-day work. Because I think for the most part, health benefit HR groups or what have you, when they're making their decisions, have been kind of a little off to the side, if you would, as compared to the 401k plans and the financial administrators in regards to protecting assets of the plan. I think that the J&J lawsuit has brought that to the forefront of there are serious issues that have to be addressed by the benefit plans as they look at their medical and prescription benefits. If I was to be, thinking as a benefit consultant, I want to make sure that I'm disclosing all my fees upfront to my clients so that they're aware of and they can make an informed decision as to what fees are reasonable and what they should be paying their benefit consultants for the work that they're doing on behalf of the plan. Benefit plans administrators should have appropriate processes and committees to make practical decisions about what benefits they should be providing and what benefit providers or service providers they should be engaging, and how that contract kind of plays out, and what aspects of that contract they should have full disclosure of revenues and compensation that their service providers otherwise are making in providing the services directly or indirectly and related to their services.
Got it. And I think one area that received some focus was gag clauses in the contracts. Have those largely been removed from contracts by now, or are there still lingering issues out there?
From what I've seen in the industry, there may be some tail, if you would, of some gag clauses that are still in existence to this day. And I think there's some question as to whether or not certain entities should remove gag clauses or are subject to the gag clause restrictions that are in the CAA. For the most part, I think most of the industry has moved to the removal of those conditions. And as you know, at Capital RX, we specifically put in all our PBM client contracts that we have no such things as gag clauses in our contracts with our clients or with our providers that participate in our pharmacy network. So I think that's kind of like an industry leading type of approach. I don't think others in the PBM industry have put such similar conditions in their client contracts as we have, but I think that's where we have differentiated ourselves from the field.
Makes sense. And then the Inflation Reduction Act, I believe the M3P or the Medicare prescription payment plan is baked into that. And of course, the ability to negotiate drug prices, among other aspects of the IRA. Do you have any updated views on the impact the IRA may have on health plans and the industry?
Well, I think as it relates to the IRA from a perspective of negotiation of drug pricing, I think we have to see how that plays out a little bit more. I know that pharmaceutical manufacturers have sued on several fronts on whether or not that aspect of the IRA is allowed under, US law or the Constitution or what have you. I'm not going to talk about whether those lawsuits are going to win or lose or where that's going to end up. I think it should be interesting, and I've always said whether there's a balloon squeeze as to how Medicare negotiates its pricing and whether or not other commercial plans, if you would, have to bear the brunt of the costs associated with the IRA in the negotiations of pharmaceutical pricing for Medicare. I'm not sure, right? That's one thing I'm concerned about. The other side, though, from the M3P, I think that's going to become an administrative nightmare for a lot of plans, and they should be concerned about the solutions that they're going to implement to basically meet that standard. And I think it's a nice thing to have where the beneficiary can defer costs at the point of sale, but I think there's a lot of aspects of that from an implementation point of view that plans need to be thinking about and kind of exploring options that are available to them. I know we have one that we're promoting to the industry, but I think that's going to be a troubling concern for the next 6 months anyways.
Yeah, it sounded pretty disruptive to all the normal workflows and file transfers and all the processes that have been in place for years between all stakeholders. So
Yeah.
that will be interesting. And then one other thing you discussed on the webinar last year, but we've all observed is the flurry of activity at the federal and state levels. It was fast and furious. Florida and New Jersey signed bills into law, and there's been some movement in West Virginia and other states more recently. But things seem to have stalled out in other areas. A lot of the legislation attacks the same practices, spread pricing, DIR fees, and clawbacks that hurt pharmacies, rebates, and pass through rebates. Can you share a quick update on where you see the most potential for meaningful change or what all this activity likely means for PBMs, plans, and pharmacies?
Yeah, I mean that's a great question, Justin. I mean, last year I don't think we've seen that type of activity before from previous years or what have you. This year I anticipate a lot of Me Too type of legislation. I think there's a little concern from an ERISA perspective on whether the Florida law withstands scrutiny. The Florida law, I think I've said in previous statements that is probably the most comprehensive state legislation related to prescription benefit services and has probably gone beyond what some people would say from an ERISA perspective is appropriate for state legislation because it's applying what otherwise have been known for plan design issues that have been preempted by ERISA from the state perspective to be, non-enforceable against self-funded ERISA plans, but it does apply, right? So unless that statute is challenged in the courts, which I've not seen anything yet from appropriate parties, it is the law in the land of Florida, at least, that law applies to self-funded ERISA plans. So whether or not other states follow suits, I think they're going to wait to see what happens with Florida first before they jump into that type of approach. But I do see a lot more states who have not passed laws looking at spread pricing, MAC list reimbursement, DIR clawbacks, all the elements that you mentioned already. I see other states looking at that type of legislation as well. And another interesting area that has popped up, if you would, as another means for the states to get a better handle on how PBMs are operating today is New York and New Mexico, for instance, have passed laws that they get to approve any merger between a PBM and another PBM. And I think that's something new that hasn't been thought of before or looked at very closely, but has an impact on how PBMs might want to consolidate further. If there is any of that element that you have to kind of run through that type of review, I guess, at the state level, where most PBMs have to be licensed these days to operate within a state. So their license would then be subject to review on whether or not a proposed merger would be appropriate for that state. And I think the state looks at elements of whether or not access, reimbursement, or pro elements of advancing healthcare interests would be advanced by that merger, or would there be the opposite effect that we have often raised, where consolidation within the industry has actually led to less competition?
That's a good one, worth watching. Okay. I'd like to switch gears a little bit. Kind of goes back to an earlier question, and it was a good question from a past guest, Jeff Hogan, actually, episode 4. I'd like to just kind of bounce this off you. And yes, listeners, if there's a topic you'd like us to cover or a question I can seek an answer to, I'm always happy to do that. So Jeff and I talked about how to attack and reverse the pharmacy spend trend, because inflation there has been uncontrollable largely, and legacy PBMs remain a black box to a degree. The question is, for most employers who don't know where to start with procurement and evaluation, or those who have this top of mind, and since we see a lot of quote unquote point solutions integrated with PBMs and carriers, from a legal and contracts perspective, here's the question: where does an employer start, and exactly what legal resources do they need to retain to help with the process, including contracting?
In the procurement process, they definitely would need to have some type of idea of what they're trying to accomplish in the process. I think a lot of people, when they go through the procurement of their existing PBM, probably just looking for savings of some sort. But I don't think they really think about their benefit plan other than, oh, I'll get $3 million savings year over year or something to that effect. And I don't know if that's really the best way to look at your benefit. I think if you have someone who actually looks at their benefit as to what they're trying to accomplish with the plan, how they're going to use their benefit to enhance their employees' work productivity, lives, and overall health, I think they just make it an aspect of their culture as opposed to just, I want savings of $3 million or something like that effect. And I think if you do it from that perspective, you'll find a benefit provider like that would probably align with your interests and help manage that goal, as opposed to just simply dollars and cents. But that's probably a little more theoretical than what you were looking for there, Justin. But I think also the other aspect that I would say from a contracting point of view is to engage someone that has experience with PBM contracting. A legal expert is probably advisable. Law firms, I know of several that I've run into over my career that I think are very reasonable and rational in helping the benefit plan negotiate a contract and avoid the pitfalls, if you would, that some PBMs tend to use in their contracts, that you're not really getting the benefit of the bargain that you're looking for. So that's what I would recommend to people is to get reputable, experienced people who have expertise in the contracting field.
Kind of related, do those folks at the law firms, others, do they normally involve, actuarial um, assessment or other, um, consultants or advisors that may have more accountability to the projections in the RFP?
Well, the law firms probably would be more focused on the actual contract document itself and how the traps that may exist could be sprung, so to speak, and kind of provide that type of guidance.
Thanks for that. And this is a question that I ask everyone. It's not my last question today, but because I have one more for you. But what's the most astonishing thing that you've seen over your time relating to these discussion topics that you can share, of course? And can you tell us a good story, funny, interesting, or otherwise?
I'm going to take the fifth on that.
You
Uh,
can't take the
my
fifth.
client privilege, I'm gonna have to assert that in a certain but I have seen quite a bit in my career, and it's probably too numerous for me to point out to one aspect of what was it most of the astonishing thing. I have run into some situations where I have been quite surprised. I just don't know if I can repeat them.
Oh, you're pleading the fifth on my astonishing question. Okay. So then I will go to a last question. Let's bust out your crystal ball. How about your thoughts on the Blackhawks future and what give us your Stanley Cup prediction?
Okay, well, this is something I could talk about. Blackhawks, although they are not doing well in the standings as of now, I think have an opportunity to do something pretty remarkable in the near future, provided they draft well in this next coming year. But I think they have a high ceiling, if you would, provided things fall into place. Whether they win 3 Stanley Cups in the next 10 years or so, we'll have to wait and see. But they have a very bright future indeed. For this year's Stanley Cup, if you want me to put my money on a team, I would look to the Western Conference as the likely champion for this year as well. And whether Vegas is able to repeat again, I'm not so sure. I have my hopes on Connor McDavid finally winning his first Stanley Cup.
Okay. Well, Lloyd, thanks so much for taking the time today and sharing your experience and insights with us. Hope you have a great rest of your day. And thanks everyone for listening.
Yeah, thank you.
Thank you for listening to Astonishing Healthcare by Capital RX. Head over to cap-rx.com/insights and visit the podcast section for show notes and other relevant content. If you liked this episode, be sure to subscribe so you don't miss the next one. And definitely share the link to the show with your network if you enjoyed it. Have a great rest of your day.